Hello, my dear nursing aspirants. Welcome you all to the Master Nursing classes. In the today's class, we are going to discuss again the most important portion of the ECG. So, this one is the third class. In the next class, I will completely wind up the portion of the ECG. So, trust me, we are covering everything that strikes related to the ECG in your exams. Okay. So, if you are preparing for NARCET exams, it's more than enough. If you are preparing for the RRB exams, my classes is more than enough for the ECG. Okay. So, all you people have to do is take a note of this one, what I am teaching here, and what are the bullet points which are coming from my side. That is the most important points. So, revise just before going to the exams and strike your best in the exams, so it will give the best rank. Okay. So, with a beautiful motivational quote, we will start the today's class. Welcome you all once again to the Master Nursing class. Good evening, beta. Good evening. Very good evening. So, welcome everyone to the Master Nursing classes. If anyone is watching the video first time, so please do subscribe to the channel, and who all are live to the session and who all are watching the video now, so please hit the like button so that will boost us to get the more beautiful and wonderful, fruitful content in front of you all, right? So please hit the like button who all are watching. Yes, fatafat do like to the session. We'll start the session. Yes, without wasting time, we'll start the session with a beautiful motivational quote. The best preparation for the tomorrow is doing your best today. Students, don't be in the past. Don't think about the past. Past is not going to change your future. The thing today which is in your hand, which can change your future, which is having the potentiality to change your future, because what you are doing today is collectively comes and stands as a backbone of your success. So that is most important. As aspirants, give your perfect on today. Okay, don't think we will watch this class tomorrow, we'll take a note tomorrow. Okay, we will revise it tomorrow. Not tomorrow. Tomorrow is not going to help you. So whatever you want to do it today. So sacrifice something in your life, then only something it will comes in your life, right? So ಏನನ ಒಂದು ಬಿಟ್ರೆ ಮಾತ್ರ ಏನನ ಒಂದು ಪಡ್ಕೊಳಕ್ ಸಾಧ್ಯ ಇರುತ್ತೆ, ರೈಟ್? ಸೊ ಕ್ಲಾಸ್ ಸ್ಟಾರ್ಟ್ ಮಾಡೋಣ. ಯಾರೆಲ್ಲ ಲೈವ್ ಇದ್ದೀರಾ ಸೆಷನ್ಗೆ, ಪ್ಲೀಸ್ ಸೆಷನ್ ಲೈಕ್ ಮಾಡಿ. ಸೊ ಏನಾರ ಡೌಟ್ಸ್ ಇದ್ರೆ ಕಮೆಂಟ್ ಬಾಕ್ಸ್ ಅಲ್ಲಿ ಕಮೆಂಟ್ ಮಾಡಿ. ಓಕೆ, if anyone is having any doubts, so people can comment in the comment box. So I will try to interact completely with you. So during the concept explanation, I don't focus on the comments. Okay, so after concept explanation only, I used to watch the comments. Okay, so if people keep commenting, so I will watch once and I will respond to everything, right? So we'll start the first question of the day. Okay, so that is, P. pulmonale is most commonly associated with which of the following condition? The simple question, the P. pulmonale is most commonly associated with which of the following condition? Right? Option A, left atrial enlargement. Option B, right atrial enlargement. Option C, myocardial infarction. Option D, atrial fibrillation. So I want your all answer here. So please do comment in the comment box. Right? First of all, we will see what is P. pulmonale. Then we will see P. mitrale. So then only people can able to understand this question and answer in the exams. Okay. So when the atrium, the right atrium, okay, all of you know this. This is the right atrium and this is the left atrium. So when the atrium contracts, when the atrium contracts, so we can say atrial systole, the P wave formation happens, right? The P wave formation happens. So here we divided the P wave as the first half of the P wave and the second half of the P wave, right? So the green highlighted one is the first half of the P wave, and this pink highlighted one is the second half of the P wave. So this first half of the P wave, it forms which forms during the contraction of the right atrium, and second half of the P wave which forms during the contraction of the left atrium, right? So totally it forms a one single P wave, right? So then what is P. pulmonale, sir? P. pulmonale is simple. When there is enlargement in the right atrium. During the right atrial enlargement, so P wave, the first half of the P wave, it will get enlarged like this, and second half will be same like this. Okay, so this is what we call as the P pulmonale. Okay, right? So this is what we call as the P pulmonale. Look at this one. Only the green highlighted one is enlarged here. So this portion is enlarged here, and the second portion of the PAV is normal. Okay, this is normal because here the right atrium is enlarged. That's what the first half of the PAV is enlarged. That is what we call as the P pulmonale. Okay, so if in case the left atrium is get enlarged, okay, so if left atrium is get enlarged, this is the P wave, and the second half of the P wave will get enlarged here. Okay, so this one, the green highlighted one, is got enlarged here. So this is what we call as P mitrale, right? So hope the concept is clear. Sir, why the right atrium will get enlarged? What is the most common cause for the P pulmonale, sir? That is the COPD. And because of the pulmonary embolism also it happens, and because of the other respiratory condition where the pulmonary vascular resistance will increases, that particular time the P pulmonale happens. For example, so I will discuss the only one and most important one, that is the COPD. That is the most common cause for the P pulmonale. So then we will go for the next question because it is very very important. And one more concept I will clear here related to core pulmonale. So core pulmonale and P pulmonale altogether it's a almost similar concept, but it's very very important one. Okay, so that is what we have to study it in a detail to remember for the long time. Okay, so let's focus here. Bacho, this is our heart, right? So this one is right atrium, this is the left atrium, this is the right ventricle, this is the left ventricle, this all and everyone know. Okay, so this is very basic. And from the right ventricle there is one artery, the big artery it will runs. So the artery name is the pulmonary artery. Okay, so this pulmonary artery which will comes from the right ventricle and it which supplies the blood to the lungs, right? So what I told here is the chronic obstructive pulmonary disease is there, so it created the congestion. Okay, some congestion, and because of this some mucus, so it creates the pressure on the our pulmonary artery branches. So when it creates the pressure over the pulmonary artery branches, the pressure in the our pulmonary artery will get increases. So pressure in pulmonary artery will increases means we can say pulmonary arterial hypertension, right? So we can say the pulmonary arterial hypertension. So which creates the pressure on the right ventricle. How, sir? How means when the pressure in the this right atrium is low means the right ventricle can contract properly and blood will go easily here. Here the more pressure is there means this requires the more pressure here, right? So it which requires the more pressure means it needs to contract hard and very hard. So daily and every minute, every second it is contracting hard means the hypertrophy of the right ventricle happens. Okay, so when there is hypertrophy of the right ventricle, the pressure is created here means the blood which is running from the right atrium to the right ventricle also it will get congest and right atrial hypertrophy also happens here. Okay, so that is what we call hypertrophy, right atrial hypertrophy. So when there is right atrium get hypertrophy, so first half of the P wave will get enlarged. So we call this one as in the P pulmonale. Okay, so we call this one as the P pulmonale, which happens due to the increased pulmonary artery pressure. The most common cause for the P pulmonale is the COPD. Okay. Similar thing I told I will also discuss about the core pulmonale. What is core pulmonale? Core pulmonale is again simple. Bacho, because of the lung problem, the heart will get failures. So that is what called as the core pulmonale. the examiner will throw a question like which part of the heart will get failure, whether the right side heart failure or the left side heart failure. So what is your answer based on this same concept? Yes, I'm waiting for your response. Okay, because of the COPD, the pressure in the pulmonary artery increased, and the right side of the ventricles got enlarged, and the hard contractions, which leads to the hypertrophy, means the enlargement of the our right side of the ventricle. Then, because of the increased pressure in the right ventricle, the right atrium also get hypertrophy. So, because of the right ventricle and right atrial hypertrophy, so right side heart, it will get fail to function after long time, after chronic long time. So right side heart failure happens. Okay, so right portion of the heart will get fail because of the our lung diseases. So that is what we call as the core, means cardiac failure because of the pulmonary problem. So that is the pulmonale. Okay, so because of the pulmonary problem, the cardiac is getting failure. So that is the which part of the heart will get failure? The right side heart failure happens. So this is what we call as the core pulmonale important point. Okay, so hope the concept is clear here, right? Hope the concept is clear here. And the answer for the question is, that is the yes, option B, right atrial enlargement, which leads to the P pulmonale, and how the right atrial enlargement causes the P pulmonale, I have described in detail. So here, not only we have studied the one MCQ, along with one MCQ, we have studied the most of the MCQs, which is surround of the P pulmonale. That is the most common cause, COPD, and because of the pulmonary hypertension, this right atrial enlargement happens, and because of the COPD and pulmonary hypertension, the right side of the heart get failure. That is what we call as the core pulmonale. So we have discussed in detail. Okay, that's most important. Okay, so then comes to the P mitrale. In the P mitrale, I told the second half of the P wave will get enlarged. So which is looking like two things. Okay, like so we can say the bifidus P wave also, this one. Okay, we can say this one as the bifidus P wave. Okay, so why this P mitral happens? Because of the mitral valve stenosis. Okay, so what is this one? So what is the actual concept behind this one? Okay, let me clear within a second, so that is helpful for you. Okay, this is the heart. Okay, so as all of you know, in the in the left atrium and the left ventricle, in between there is wall. This wall we call as in the mitral wall. Okay, so what we can say, this one we can say as a mitral wall. Okay, so this mitral wall is got stenosed. What is the stenosis? Stenosis is the narrowing. Okay, so this is the opening, this is the normal open. So this open becomes narrow, means we call this one as in the stenosis, right? So if this mitral wall gets stenosed, means the blood from left atrium will not come to the left ventricle. So the pressure in the left atrium increases. Okay, so because of the increased pressure in the left atrium, right, because of the increased pressure in the left atrium, so left atrium need to work hard. Okay, so it's working hard, means its size will get increases. So that is what we call the hypertrophy of left atrium. Okay, so this is the important reason for the P mitrale. So here the left side of the atrium will got enlarges. Okay, so because of the left atrial enlargement, the P mitrale happens. Okay, so because of the mitral wall stenosis, the left portion of the atrium is got enlarged. So that means the P mitrale happens. Okay, I have told this one in detail. Okay, so P pulmonale indicates the right atrial enlargement, and P mitral indicates the left atrial enlargement. Important. Okay, so take a note of this one. Okay, and try to do the best shot and best answer for this question. Very important question. What is the characteristics of the ECG findings in atrial flutter? So this one is your 1000 point important question, bacho. Right? So what is the characteristics of the ECG finding? I think all people know, the real true aspirants and competents know the answer. Yes, the very hot and hottest question. What is the characteristics of ECG finding in the atrial flutter? So, what is the flutter? In yesterday's or in the first class, I think I have told the flutter rate is between the contraction of the 250 to 350 beats per minute. If the atrium is contracting, we call this one as the atrial flutter, right? So in this one, the characteristic feature of the atrial flutter is the sawtooth pattern appearance of the our flutter waves. So this kind of the P wave will come. So look at this one, atria. Atria means where will be the problem? Yes, problem will be in the P wave only. Okay, so like this. Then the normal QRS complex, right? And T is also normal. Again, the P wave it will comes like this. Okay, like sawtooth. Tooth, you know, tooth. Okay, so it looks like a sawtooth. Okay, so that is the very important and normal QRS complex, right? So this will happens here in the atrial flutter very importantly. Okay, so then the next question is waiting for you all. So the question is like this: what is the typically absent in the ECG of the patient with atrial fibrillation? The most important concept, atrial fibrillation and its relationship with stroke. I will discuss in the next question. It is a very important concept that will strike in your NARCET 8 exam again. So before the NARCET 7 exam also, before the NARCET 7 exam also, I have told you people the relationship between the our atrial fibrillation and stroke and the preventive measures. As atrial fibrillation starts, we need to start the anticoagulants. This one I have told you people. Okay. So there the concept was somewhat tricky in the exams and many people have done the mistake, but the master nursing classes student rocked in the exams, right? So that is a very important thing and very a unique feature of the master nursing classes which strikes the questions in the exams. Okay. So yes, now tell me the answer. So which of the following wave is absent typically in a patient with ECG, in patient with atrial fibrillation? Okay. So what I told, it's a fibrillation. Fibrillation means the heart rate is more than 350 beats per minute, right? Okay. In the yesterday's class, I told heart not contracts, only shakes. Okay. Heart will not contract, it will only shake like this. Are you people able to see my hand? It will shake like this. Okay. So contraction means like this, right? If heart is contracting means normal P wave will generate. Okay, like this. If heart is shaking means the wave will not generate. Okay, so it may leads to the F type, or we can say the absent P wave. Okay, because the problem is in the atria, the problem will come in only P wave. The QRS will be the normal here, right? So this is very important. In the atrial fibrillation, typically absent P wave will be the characteristic feature of the atrial fibrillation. Then comes to the hottest question: which of the following intervention is commonly recommended for stroke prevention in a patient with atrial fibrillation and a high risk of the stroke? The relation I will explain, the management I will explain. Remember, give your best shot in the exam. If the any questions which is coming related to the atrial fibrillation and there may be any sign of the stroke, that may be a facial weakness, upper arm weakness, slurred speech. These are the initial stage of the stroke. Okay, slurred speech, facial weakness, arm weakness. So very importantly, if patient is atrial fibrillation and slurred speech, arm weakness, facial weakness is characteristic as the earliest feature, think about the stroke and manage the stroke immediately. That is very important. Sir, atrial fibrillation is arrhythmia case. Stroke is a central nervous system problem. Why you are telling like this, sir? बच्चों, here is the relationship between both. Let me clear the concept. How, sir? As I told, this is the what it is. It is heart. Okay, so this one is the left atrium. So in the left atrium the blood will be there, right? In the left atrium the blood will be there. When the left atrium contracts, this blood will come like this. But left atrium is not contracting, it is only shaking. Means the blood which is there here, it will get clots. In the hematology videos I told, only the flowing blood will be in the dilute form or it will be in the liquid form. The blood which will stands in a single particular one place, it will get clot. This is the fundamental role of the blood, right? So the blood which will stops in one particular area, it will get clot. Similarly, here the left atrium is not contracting. The left atrium is not contracting means the only shaking because of the fibrillation. So the blood will get clot. When this particular clot, it will enters into the left ventricle. If left ventricle clot contracting here, look at listen here, bacho. I am talking about the atrial fibrillation. Means the atrium is shaking, but the ventricle may contracting normally. May contracting normally. Okay, if it's contracting, means this clot will go into the our aorta, right? So the clot will go into the aorta. Let me make it proper diagram for you all. Okay, so here it will be aorta, right? So in this portion of the aorta, here we are having the branches. Okay, so this is the brachiocephalic artery. So here from the right common carotid artery and the brachial artery it will generate. Okay, from this side, left side common carotid artery and left side subclavian artery it will generate. Okay, but here this clot which is coming from the left atrium to left ventricle, from the left ventricle to the aorta, from the aorta to the common carotid artery. Okay, and from here the carotid artery will supply to the brain. So if it's circulating the clot in the brain, means for small blood vessels in the brain, the clot will get struck. Okay, so this is what we call as in the embolic stroke. Embolic stroke. The dangerous risk factor for the embolic stroke is the atrial fibrillation. Sir, what we have to do for this one? Yes, whenever you will see the atrial fibrillation in the ECG, immediately start anticoagulants. First is the heparin. Okay, so if it is not available, we can go for the warfarin also. So injection heparin is the priority here, right? So it's important. It's very, very important. Why? Because the heparin, it will get dissolves the clot. Okay, so it will try to not to destroy the clot. It will prevent the further formation of the clot one, and it will not allow the blood to get clot. Okay, so that's what we call the anticoagulants, right? So anticoagulants are not given to destroy the clot. For the destruction of the clot, we are giving the thrombolytics. That is the different things. Okay, so thrombo means the clot, lysis means break. So thrombolysis means the breaking of the clots. So that is where we are giving the another drugs like called atiplase, retiplase, tinoplase, and TPase. Okay, tissue plasminogen antigen. The atiplase, retiplase, tinoplase, this kind of the drugs we are using as the thrombolytics to destroy the thrombus. Here, the heparin is an anticoagulant. So it is not allow the blood to get clot only. Okay, that is the very, very important. So start the anticoagulant is the most important. Now give the answer for this one. So which of the following intervention is commonly recommended for the stroke prevention in a patient with the atrial fibrillation and high risk of the stroke? Yes, option A, use of the anticoagulants. The option A only it is correct here. Okay, so then comes to the option B, that is the digoxin administration. We will not recommend this one, so I am eliminating this. Then antihypertensive therapy, not recommended. Antiarrhythmogenic drugs we can give to reduce the atrial fibrillation, but it will won't prevent the stroke, so it will be not our answer. So hope the concept is clear here, bacha. Okay, so very, very important, very important. So the next question is like this. Okay, so take a note on this one. Let me change the pen color here. Yes. Okay. So the pathological QA is most commonly associated with which of the following condition? The pathological QA is most commonly associated with which of the following condition? Simply, bachon, remember this one. It indicates the old myocardial infarction, and almost all of people have the given the correct answer. So that is the B is the correct answer. So how we have to see means, if the patient with the myocardial infarction who comes to the our hospital means, the earliest change is the tall T wave. Okay, tall T wave, or we can say the hyperacute T wave is the earliest change in the ECG in the myocardial infarction. Okay. Okay. So we will now treat for the myocardial infarction. Then patient will go back to his home. Okay. He will go back to his home. So after 3 months, he is coming to our clinic. Again, we are taking the ECG. At that time, T wave won't be tall here. Okay. T wave comes to the normal. But the Q wave is remains abnormal here. Okay. Q wave is remains abnormal. One in a lifetime myocardial infarction happens means the Q wave becomes completely abnormal. Okay. So that is the reason it indicates the old myocardial infarction. Q wave indicates the old MI. It's important and it's very important. Okay. Remember for this, for your exam purpose, right? So here is the next question. So which of the following ECG finding is commonly associated with the right side bundle branch black or triple B? Okay, very important, very important for NORCET 8 mains exams. Okay, for NORCET 8 mains exam purpose. And prelims also it may strike, but there is highest chance for the mains exam because it's a somewhat advanced question for you all, right? So which of the following ECG finding is commonly associated with the right side bundle branch block? So give the answer here in the comment box. Option A, wide QRS complex that is more than 0.12 second with RSR pattern in the lead V1 and V2. That is what we call as the bunny eye like rays. Or we can say the bunny ears like ECG pattern, which is classically seen in the right bundle branch block, and few only 2 to 3 students have given the answer. That is the correct answer. Wide QRS complex more than 0.1 to 2 second. More than 0.12 second with the RSR pattern in lead V1 and V2. So that is indicating bunny ears like. So this is the classical feature of the right bundle branch block. What is the right bundle branch block? Let me tell you. Bachon, so all of you have know this is SA node. From the SA node, we are having the internodal pathway. Okay, so this internodal pathway comes to the AV node. This is the SA node, sinoatrial node. This one is the AV node, atrioventricular node. From here, bundle of His. From here, the right side one branch will come, the left side one branch will come. So right one we call as the right bundle branch. Left one is the left bundle branch. If any blockage in the transmission of the electrical signals, so normally electrical signals will forms in the SA node. So the SA node, it will having the generativity ability, conductivity ability. Okay, so it generates the SA node in the SA node generates the impulses with the help of the autonomic nervous system. Okay, so this SA node, which is sending the electrical signals, okay, it will transmits like this to SA nodes to AV node, from AV nodes to the to bundle of His, from the bundle of His to the right bundle branch, left bundle branch. If in case any blockage in the right bundle branch, left bundle branch, so if the right side blockage means, that is what we call the right bundle branch block. If the left side blockage means, so we can say that is the left side bundle branch block. So this is what we call as the left bundle branch block. So here you people have to have to know one mnemonic, not mnemonic, the concept that may helps you to solve the question in the exam. Okay, so what is that concept, sir? So that is what I'm telling, bundle branch block. Okay, not blood brain barrier. It's a bundle branch block. Okay, so the right side one and the left side one. So this is the right bundle branch block. This is the left bundle branch block. Okay, so here it's a problem related to the our ventricles now, right? So here the atrium finished. So from here the ventricle started. So means in which part of the ECG we can say the problem. So here the P is normal, but the QRS complex is problematic here, because in the basic only I have told the P wave generates because of the atrium contraction and QRS complex generates because of the ventricular contraction. Okay, here the problem is related to the ventricular contraction, means the problem will come in the QRS complex. Okay, so in the QRS complex, like P wave, then it's generating, then it's coming down and it's going up and it's coming like this, means the M type M type Q wave is forming this. Sorry, this is P Q R. Okay, S T. So M type QRS complex, or we can say the M type of the R wave, which generates in the our right bundle branch block. Very very important. In the left bundle branch block, the W type. The W type R wave will generate in the left bundle branch block. So this is important and remember. So we can say here, which is looking like this particular image. Look at this one, M type, this particular red one. I'm highlighting with the green highlighter here. So this one here, it's going up towards the R, right? Towards the R wave. Then it is coming down towards the S wave. Then it is again going towards the R wave. So we call this one as in the R, S, R pattern. And this is the bunny. This is the bunny, and which is looking like the ears of bunny. So we can say this is the bunny ears pattern. Okay, so bunny ears pattern or SR pattern kind of the ECG in the QRS complex is a classically indicating the right bundle branch block. Okay, so in the left bundle branch block there is a negative depletion in the QRS complex. Okay, negative depletion we can say. Negative depletion in the QRS complex, it's important. Okay, so it's important. The examiner will throw questions. Okay, like in the right bundle branch block. So what we have to see? Wide QRS complex. Why wide QRS complex? Why? Because there is no transmission of the signals. So the QRS complex become wide. Okay, so it's wide like this. So in the first video only I told the QRS complex, then P wave, then PR segment. Okay, so it's complex, it's wave, it's a segment. So all these three forms in the 2 to 3 small box. Okay, so 2 to 3 small box means the normal duration is the 0.8, so 0.08 to 0.12 seconds. So this is the, sorry. So this is the 0.08 to 0.12 second is the normal duration, right? So if it is going more than 0.12 second, so that indicates the prolonged or wide QRS complex, right? So with the RSR pattern I have told here, okay, here the wave. So look at this one, P, Q, R, then S, here it will be the T, right? So look at the wave which is going up towards the R, then which is coming towards the S, like so it's coming down. Then again it is going towards the R, right? So this is what we call as the RSR pattern. Okay, so RSR pattern. So this is indicating the right bundle branch block. Very very importantly. So look at this ECG, it will get clarity to you all. Okay, so focus here. Here it is rising, right? So here it is rising. Look at the here it is rising. So again it is coming down, then again it is going off. Okay, so like this it is forming. So this is also we can say the M type or the RSR pattern, right? So it's a very important. It indicating the right bundle branch black. So it's clear for you all. Okay, so in the ECG it's clear. Look at this portion. Right, so this is the RSR pattern. Hope it's clear. Okay, so image based also I am focusing repeatedly because that is a very important question. Okay, so here is the next question. Which of the following ECG finding is commonly seen in a patient with Wolff-Parkinson-White syndrome, WPW syndrome? Okay, so here we can see the ECG finding as a commonly in the Wolff-Parkinson-White syndrome. Bacho, so remember this one. So it will be helpful for you all. Here the PR is the short. Okay, so you can say the short. QRS is the long. So we can say wide. Okay, and positive delta wave. Okay, we can say delta wave. So classically these three findings. PR is short, QRS is wide, and positive delta wave. So how, sir, how it will form, sir? Let me clear. I am here to solve your all the doubts. Okay. So in the Wolff-Parkinson-White syndrome, what happens? The PV will generate like this, but the QRS complex will be like this here. Okay. So it's an P wave, and this is a Q R S T. So it's forming a delta-like wave. Focus here, bacho. So this is what we call the delta. Okay, so it's in positive delta wave. It's in positive delta wave. Plus from here to here, it will take more than the 2 to 3 box. Okay, more than the 2 to 3 small box. Normally 2 to 3 small box our QRS complex should generate. Or we can say within 0.1 to second our QRS complex should generate. If it is going more than 0.1 to second or it's going more than 2 to 3 small box, it indicates the prolonged QRS complex. So because of this one, the PR segment also become short here. So altogether, the positive delta wave, the short PR, I will fix the voice issue. Please don't worry. Just wait a second. Yes, the first one is positive delta wave, second one is the short PR interval, and the most importantly, third one is the our prolonged or wide QRS complex. So that is our Wolff-Parkinson-White syndrome. It's most important and very important. In which option it is there? Option A, shortened PR. Yes, it's a short PR and positive delta wave. Yes, it is positive delta wave and wide QRX. Okay, so these all four, which in all three is a classical picture of the Wolff-Parkinson-White syndrome. So that is most important for you all. Okay, so here is the next question. Do read the question. It's also very important question. Right? The T tau wave on ECG are most commonly associated with which of the following condition? The tau T wave in ECG. Tau T wave in ECG, which indicates, yes, I know it's very easy question, and many students they will do mistake while attempting this question because they know the answer which will happens in this particular condition. While choosing the answer they will do gadbad because the words which were given in the options which look similar. Okay, so don't confuse because every 6 months every yearly one opportunity will come in front of you as a exam. So when you are sitting in front of the exam, you know it tall T wave happens in the hyperkalemia, but while choosing you people will choose by mistake like hypokalemia because of the time pressure, because of the pressure which is created by exam in your mind. So don't go under pressure. Be cool, calm, relax. But I have given nearly 10 plus central government exams. So I have never personally felt that the time is less. Recently for the NARSET pattern also 18 minutes 20 question. I have left with the 4 to 5 minutes time in every section. So which happens when you practice as the test series on the daily basis and when you make it a rhythm for the everyday. So it should be a routine for you. So then only you people can crack the NARSET like exams. Okay. So NARSET is not like very simple. So it is for the hard worker. It is for the who is running behind their goal. So it is for them. Okay, so make a practice of the best question papers. So here the master nursing classes also we have launched the 95 question papers. In every sections we have covered the nursing, non-nursing, everything. Okay, it's very affordable price we have kept. Just do download the app. The link is given in the description box, and from there you people can attend the test series on the daily basis. We are announcing the All India rank in our WhatsApp group, Telegram group on the daily basis. The live exam will start from the 6 a.m. to 11 p.m. After that, you people can give the exams also, but the rank will not consider in the All India rank. Okay, so then you can re-attempt the exam also. Then you can view your entire solutions which are prepared by the expert. So students, believe me, from our test series, there is definitely going to strike many questions in the exams because it's prepared by the expert who recently cracked the more than 4 to 5 exams. Okay, so if you are not still you have didn't downloaded the master nursing classes app means so do download that one. So in very affordable price we are giving the high quality and highest quality content for you all. So yes, very nice. Okay, so if anyone is watching this one first time, so do subscribe to our YouTube channel also. It's free of cost, right? So we'll start. So tall TV will seen in yes. Option A, hyperkalemia, hypokalemia. Option B, hypocalcemia. Option C, then hypercalcemia. Option D. So what is your answer here? The tall T wave. The tall T wave seen in the hyperkalemia. So what is hyperkalemia? Hyperkalemia is the more potassium. So then what is normal potassium? Normal potassium is 3.5 to 5.1 milliequivalent per deciliter is the normal potassium. If it is going more than 5.1, so that is what we call as the hyperkalemia. Okay, in the hyperkalemia, remember the calcium increasing, so the potassium increasing means the height of the T wave also increases. The height of the T wave also increases. Okay, the potassium decreasing means the height of the T wave also get decreases. Okay, so in the hyperkalemia, we can see the tall T wave. In the hypokalemia, we can see the inverted T wave. Okay, so we can say the inverted T wave like this. So we can say this one as in the inverted T wave. Okay, means ulta T wave. Okay, ಅರ್ಥ ಆಯ್ತಾ? ಸೊ ಹೈಪರ್ಕೆಲಿಮಿಯಾ ಅಂತಂದ್ರೆ ಟಿ ವೇವ್ ಟಾಲ್ ಆಗಿರುತ್ತೆ, ಹೈಪೋಕೆಲಿಮಿಯಾ ಅಂತಂದ್ರೆ ಟಿ ವೇವ್ ಉಲ್ಟಾ ಇರುತ್ತೆ. ಸೊ ಈ ಪರ್ಟಿಕ್ಯುಲರ್ ಕ್ವಶನ್ ಬಹಳ ಇಂಪಾರ್ಟೆಂಟ್ ಕ್ವಶನ್ ಆಗಿರೋದ್ರಿಂದ ಈ ಹೈಪೋಕೆಲಿಮಿಯಾ ಮತ್ತು ಹೈಪರ್ಕೆಲಿಮಿಯಾದಲ್ಲಿ ಏನೇನು ಇಸಿಜಿ ಚೇಂಜಸ್ ಆಗ್ತವೆ ಅಂತ ಒಂದೇ ಕಡೆ ನೋಟ್ಸ್ ಮಾಡ್ಕೊಳ್ಳಿ. ಸೊ ಇದನ್ನ ನೀವು ಜಸ್ಟ್ ಬಿಫೋರ್ ಗೋಯಿಂಗ್ ಟು ದ ಎಕ್ಸಾಮ್ ಒಂದ್ಸಾರಿ ರಿವಿಷನ್ ಮಾಡ್ಕೊಳ್ಳಿ. ಸೊ ಇದು ನಿಮಗೆ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ. ಓಕೆ, ಸೊ ಇಸಿಜಿ in this is ECG in the hypokalemia and this is ECG in the hyperkalemia. Okay, so make a note of this one. In the hyperkalemia, the T wave become tall and ST segments elevated, right? Then most importantly what happens? Yes, because of the hypercontraction P wave start to disappear. Then one more, anyone wants to answer? Yes, answer in the comment box. Anyone wants to answer means answer in the comment box. I'm waiting for the last one. Yes, that is the PR become PR, that is the prolonged. So this is the most important ECG changes in the hyperkalemia, where the potassium level will increase, the T wave becomes tall, the ST segment becomes elevated, the P wave start to disappear, then PR will get prolonged. Okay, this is the classically seen in the yes hyperkalemia. So the question may comes like this: which of the following is not a characteristics in the ECG with the patient with the hyperkalemia? Okay, so among these, any three options they will give. One more options they will give like inverted, like we can they can say the inverted QT interval. Okay, inverted P wave like that. Okay, so it's very important. This is the classically four changes in the hyperkalemia, very important. Then comes to the hypokalemia, ECG changes. Very importantly, just now only here the hyperkalemia tall T wave means here in the hypokalemia inverted T wave. Okay, along with this one inverted ST segment we can say, right? What happens to U wave? Anyone wants to answer? Okay, ST segment depression we can say. Then what happens to U wave? U wave, U. Yes, I'm waiting for your answer. What happens to U wave? Yes, U wave becomes prominent here. So this is the classically seen in the hypokalemia. Bacho, very important. So from this particular phase, take a screenshot of this one or take a note of this one. It is 1000% important for your exams. Okay, so it's very important, right? Okay. So here is the last and best question for the today's class. So do solve the question, so it will help you all. Okay. Tall T wave in context with a myocardial infarction is typically evolved during the which phase. Okay. So the question is asking. So when we see the MI patient, there is an acute phase, subacute phase, recovery phase, and chronic phases. There are many phases. Okay. So of the myocardial infarction, among all these phases, the tall T wave is seen in which phase? Yes, the answer is acute phase and early phase we can say. And in the last question only I have discussed the earliest change of the ECG in MI patient is the hyperacute T wave. Okay, that is the hyperacute T wave is the earliest change in the ECG, right? So very importantly, Bacho, in the today's class we have discussed the most of the image based questions also and theory based questions also and questions related to the electrolyte imbalance also. In the tomorrow's class, that is the last session on the ECG, I will wind up the ECG where I am going to discuss some important arrhythmias, okay, and their treatments. Most importantly, all people have to follow the tomorrow's class because just I have covered the questions which comes from the practical portion, theory portion, from the ECG normal and abnormal things. Especially on the arrhythmias, one more classes will be there where I'm in that portion I am going to discuss what is the torsades de pointis, what is the most common cause for that one, the treatment of the torsades de pointis because it's striking recurrently in the exams, okay, and other arrhythmias. So I will discuss in the tomorrow's class and myocardial infarction related classical changes. What are the list of the classical changes in the ECG? Also, I will discuss in the tomorrow's class. Okay. So if anyone is having any doubts related to the today's class, so please do mention your doubt in the comment box. So I will try to respond to your doubts. Okay. So it's very important to be consistent in your preparation. And all of you know that very few days left for the NORCET 8 exams. So keep preparing and watch the videos which I are posting in my YouTube channel. So it's important for you all. Okay. So as exam is near, so I'm posting the important classes. Okay, so it's important. Any doubts? Thank you so much, beta. Thank you so much. So keep loving, keep learning, and keep growing. So that is the special characteristics of the champion aspirants, right? So don't be in sad mode of the CRA results. So it is the temporary which come as a hurdle in our aspirants' life. So don't worry about that one. Okay, so we'll wind up the today's class. Yes, can we wind up? Okay. So if anyone wants to join our WhatsApp group, the link is given in the description box. And Telegram group link also I have given in the description box. And the master nursing classes, yeah, link also given in the description box. So whoever wants to prepare as a true champion for the NARCET exams, so please do attend our test class, test series, which are very important for you all. Okay, so we'll meet in the next tomorrow's class again. So tab tak ke liye jai hind jai bharat.